welcome to Question Time. Tonight we are at the RAF Museum in Hendon in North London. On tonight's panel, Rachel Maclean, the Government's Minister for Safeguarding at the Home Office, previously Transport Minister. Labour's Shadow Secretary for Women and Equalities and Chair of the Labour Party, Annalise Dodds. Entrepreneur, founder at the age of 20 of the social media company Social Chain, author of Happy Sexy Millionaire, and the latest and youngest ever investor to join the BBC's Dragon's Den, Stephen Bartlett. Michael Portillo, Junior Minister under Margaret Thatcher, member of John Major's cabinet. He left politics in 2005 and is now television's top railways man. And actor, star of stage at the RSC and the National Theatre, regular on TV series such as Casualty and EastEnders, and most recently famous for her role as Lady Danbury in the Netflix series Bridgerton, Adjoa Andoh. Good evening. Welcome to my panel. Welcome to our audience here joining us in Hendon, and of course welcome to you at home. We are sitting beneath a Lancaster bomber. No doubt there'll be some political crossfire tonight. Come on, it had to be said. So, joining the conversation the usual way on social media at BBC Question Time, and let's hear what you've got to say. OK, we'll get the conversation going with our first question tonight from Victoria Devison.
Has the public lost all confidence in the government's ability to tell the truth?
Well, have you lost confidence, Victoria?
Well, I lost my husband to COVID, and I know that the bereaved families have lost confidence in Boris Johnson for a long time. He promised to meet us and talk and learn lessons, and it took him a year and a half to meet with us. And he said that he also said that he would appoint the chair, he would appoint the chair of the COVID inquiry before Christmas, and he hasn't done that.
And what do you make, Victoria? Well, first of all, I'm very sorry to hear about your husband. What do you make of what you've been hearing from the government in the last week or so, this business about parties, not parties?
You know, most people say when they're being interviewed, they don't know what to say. Anger, sadness, it brings it all back, you know. And, you know, my husband died at the beginning of the virus when Boris Johnson was joking about just wash your hands to happy birthday. And Whitty was saying, oh, that it's only the ill and the elderly that died. And my husband was 59 and he was fit and healthy. And it just brings it all back, and the bereaved families are devastated by all of this, and we feel that Boris Johnson should leave.
All right, well, Victoria, as I say, my condolences to you. So Victoria's question is, has the public lost all confidence in the government's ability to tell the truth? Rachel?
Well, can I say, obviously, my condolences go to you and all of those others, and I will, of course, take your plea back to the Prime Minister to follow up on his promise to meet you, because I think that is important, and I'm sure that's something that he wants to do. But look, I can't answer what the public think. I just have to make sure that we continue to focus on beating this virus.
No, but hang on, Victoria. Rachel, sorry. Victoria's question, forgive me. Victoria's question, has the public lost all confidence in the government's ability to tell the truth? You must have a view on that after the week or so that there has been of a slew of headlines about the government, a party, a not party, COVID guidelines were followed, now there's going to be an investigation. What's your view? Well,
I mean, look, I'm not here to defend the indefensible. I will say that right up front.
And what do you think has been indefensible? What the government has been saying, Boris Johnson has a slew of senior ministers saying all COVID guidelines were followed, there was no party. Is that the indefensible, or is it the party itself?
So what I want to say about that, and I think it's worth just saying this right at the beginning, is that clearly when I saw that video that everybody else saw, I felt just as sickened as probably most people did. I couldn't see my children or my parents over Christmas. Of course, many of my constituents and people in this country lost loved ones. We've had serious illnesses. But we need to focus on the big picture, which is beating this global pandemic. And we need to get back to how do we come together as a country? We've done that right from the start. The British people, I don't underestimate the intelligence of the British people. They've got a huge amount of common sense. And I know that people will want to continue to do the right thing, to protect their loved ones and their families, so that we can actually beat this virus.
Okay.
This week we've reached the target of 21 million boosters. And I think that is the way that we're going to get out of this pandemic. And I know that the British people are going to continue to support that.
Well, just as you said, I don't underestimate the intelligence of the British people. A whole raft of hands shot up. So let's hear from. So where shall I begin? There's so many. The woman at the back in the pink jacket.
Yes, we hear a lot from politicians about what the people should be doing. But I don't actually hear an awful lot about what the politicians are doing and what they should be doing. What we do hear a lot of is what they ought not to be doing. But it always seems to me, what comes from politicians, is that what the people are doing, what we should be doing. But what about what the politicians should be doing?
OK. The man here in the middle in the navy sweater and the pink shirt.
Hi there. You say that the British public have got common sense. Why do we get treated like we don't have common sense when it's just lies after lies? I mean, my grandma passed away in December last year, and it was a very painful time for the family because we couldn't go and see her. The thought of her being on her own as she passed was quite devastating. And to hear that, you know, the government are having this party doing their thing is disgusting. And to be honest, I don't know what's worse. The fact that this party happened, which, to be honest, is probably not shocking, or the fact that nobody will take responsibility, no one will own up to it, and people are laughing and mocking us. Like, the nation is being mocked by people that are talking about this. It's an absolute disgrace. We need some accountability. And who's going to be the Tory that's going to stand up to Boris and actually say, no, this did happen, I'm going to tell the truth about what happened, and, you know, we need to actually learn from these things if we're going to move forward and improve behaviour. That's not going to change if people still keep refusing that anything, you know, was done that was wrong in the first place.
Michael Portillo, is there going to be a Tory that's going to stand up to Boris Johnson? Is that you?
I would guess that Boris is sort of teetering on the edge of a cliff at the moment, because what matters to the Conservative Party is whether he is an electoral asset or not. I mean, he has been a tremendous electoral asset. You know, he won the London mayorship twice. He won this huge majority for the Tories. He got Brexit done. He clearly was an electoral asset. But when you listen to an audience like this evening that is saying, you know, pretty consistently across the audience that they don't believe him, people are going to be asking whether he's an electoral asset or not. So the question that was asked in the first place was whether people have any confidence in hearing the truth. I think they don't. On the other hand, I think actually the government's COVID policy has turned out to be pretty good, and I think probably better than most countries' COVID policies. That is to say, we got on with the vaccination programme. That enabled us to restore a lot of our freedoms in the summer. Since then, we've had quite a high level of infection, which has probably been not too bad a thing, because the immunity is spread through the population, including through the population that wasn't vaccinated. Our level of deaths has remained very constant from the summer and through to the present time. The hospitalizations have not gone up. When you see what's happening in Germany and the rest of the continent, you see suddenly the number of infections is rising very, very sharply, and their populations are less vaccinated. So although I perfectly understand why people don't think the government is telling the truth, I don't think that is quite the same thing as to say that you shouldn't have confidence in some of the government's policies.
A woman here in the purple sweater.
I think it really sticks in the throat to be told that we need to come together as a nation when we're just faced with a lot of lies and double standards. And I think where we are coming together
And who
is
do you
to say
think
that
is-
needs to stop.
Who do you think is lying?
Boris definitely is lying about a lot of things. And generally, we're just being told one thing and then told a different thing a week later. It's very difficult to have confidence when it's very much kind of, oh, one thing for one people, a different thing for another set of people.
Okay. The woman here in the brown sweater.
I think we are being lied to, but we're also being distracted. So parties at number 10 are appalling with what the country's had to go through in the last year and a half, 2 years. But the government is also seeking to criminalise protesting. Effectively, protesters, you're shaking your head, but effectively protesters
because
and
we're not.
protesting will now be criminalised, and protesters, what used to be a democratic freedom and expression of going out to protest, which is what we've enjoyed, will now be punishable for up to a year. So my question is what impact is that going to have on society if protests are being criminalised, there's censorship, and there is silencing of any criticism of government? Where does that leave us next? Things like this are going to be shut down. It's a huge violation of our freedoms, and that's not where the conversation is. Not in mainstream media, it's not what we're angry about, and I feel like that's where the conversation should be, because it's happening now, and it's happening under our noses, and we're talking about Christmas parties, which, to be honest, it is appalling, but not surprising.
We're talking about it in part. I hear your point. Lots of people have asked about it this evening. So, and I hear what you say, we're getting a little bit away from the question. Has the public lost all confidence in the government's ability to tell the truth? Adjoa.
You know that saying that used to drive me mad when I was a kid, do as I say, not as I do. I think there's a great sense amongst a lot of us about what is fair and what is fair behaviour. We've had, you know, Petgate, Partygate. We've got the new Babygate. There's a wallpaper thing with the flat and everything.
I'm not sure there's going to be a gate about the baby, is there?
Well, there will be.
That seems quite a burden to put on this baby. It's only a few hours old.
I know, but I just think that we are, as a nation, have been really admirable in this period. We've taken care of each other. We've taken care of people we don't know very well. We've tried to stick by the rules. I think people have been socially conscious and responsible throughout without sort of being told a lot of the time to do that. And we have sacrificed a lot. We're in a place that speaks of sacrifice and nation sacrifice. And I'm so sorry about your husband, Victoria. Lots of us have lost beloved people or have not been able to spend time with people who we know are fragile and isolated. I think we are all suffering from a great amount of grief, whether it's loss of certainty about how life is going forward, whether it's loss of jobs or beloved ones or financial security. All sorts of things have been going on for us. And throughout, we've all tried to behave honourably.
And have you lost confidence, this is a question, in the government's ability to tell the truth?
Yes, absolutely. When we have been told all week, you know, that assurances were given that all the rules were followed, well, who gave the assurances, and why do we need to have an investigation into this? Surely employees speak truth to their employers. So either the assurances were given and somebody lied, or somebody knew that the rules weren't followed and they're choosing to say that they were followed. There are lots of people saying, well, I wasn't there, so I couldn't possibly say. You know, the public aren't fools, they're not mugs, and they can smell dishonesty. And what we want is to be guided by people we feel are honourable. In order to address the pandemic, what you need is faith and confidence from the public and goodwill from other politicians. And if you feel that there are lies at the centre of the people who are supposed to be leading you, it's very hard to sustain goodwill, and it's very hard to sustain faith and trust, and they are essential for good quality leadership. Man here. Yes.
It is very worrying that this story came out, shocking though it is, a year later. Why was it not why did it not come to light sooner than a year? And are there any other skeletons in the Conservative closet that we don't know about?
Well, there are allegations now about 6 or 7 parties at Downing Street. 3 are being investigated in the PM's flat, though that's been denied, Conservative campaign headquarters and another government building. So there's a kind of raft of them suddenly coming to light here. Yes, the man here in the tartan scarf.
I think it's a good question about whether the public's lost confidence, but I wonder if the public ever had confidence to trust this government. Lest we forget...
Well, lots of people voted for it.
Well, lest we forget, this is the same government that gave us Brexit, and Boris stood by the side of that bus, and I'm pretty sure the NHS hasn't got an extra 350 million a week. For this election that people voted for them for, he promised that he had an oven-ready Brexit deal. Subsequently, I think anyone will see that it wasn't particularly oven-ready, and we're still dealing with the crumbles of that bakings today. So I feel that the public did vote for them, but on the basis that they couldn't trust them because they'd lied to us before they were elected. So this is just a consequence of what we asked for. We wanted someone to get Brexit done, ultimately. Brexit has been done, but we've got 4 more years to deal with this, and that's the challenge that we face.
Annalise Dodds, has the public lost confidence in the government's ability to tell the truth?
Well, I think we're at a very worrying time indeed, and this issue is felt so viscerally by so many people, and clearly a lot of people in the audience now, because I think we all know what we've been through and what our families have been through, what our communities have been through, the people who've been lost from this horrible disease, you know, people who weren't able to see their parents, in some cases missing the last Christmas they could have had with them before they passed away, just as was mentioned earlier. And the fact is that the great British public followed the rules. They followed the rules. But senior Conservatives decided those rules weren't for them and they could be set aside. And that's what we're talking about now. And of course that impacts on people's trust in government, and particularly in this Conservative government. And they've got to get a grip on this now. We can't continue with this situation.
So how could they get a grip on it? There's now going to be an investigation by the Cabinet Secretary into 3 of these alleged parties.
So
do you have confidence in that?
Well, there must be that investigation. It's really important, but it shouldn't just be into those 3 parties. It should be into any parties that took place that were against the rules. We need an investigation into all the public money that's gone into those crony contracts, the millions upon millions of pounds that have gone into those contracts, and we need that inquiry, the inquiry that bereaved families were promised would be going by now. If we don't have that transparency, the Conservatives will never be able to draw a line under this.
Stephen.
Yeah, so the question was, has the public lost confidence in Boris Johnson?
Well, in the government's ability to tell the truth.
In the government's ability to tell the truth. I know Rachel said that she can't speak on behalf of the public, which I find interesting because politicians always answer on behalf of the public when they're setting legislation. But I will take it upon myself to speak on behalf of the public, and I will say that the public has definitely lost trust in the government. And to me, as a 20-something, watching politics play out in this country, this is when you know you're screwed. When your government becomes a more interesting reality show than Love Island. There's been cocaine, there's been an affair, lies. Every single week, every time I refresh my Twitter feed, the breaking news story from this government is someone has lied, deceived us, and there's double standards. How could you possibly, in that context, have trust that these people will lead us out of a pandemic? And the consequence of a lack of trust is very clear. They did a study in Europe, I think it's the European Social Survey, where they looked at vaccine adoption and they saw how in some countries where they have higher degrees of trust, more people adopted the vaccine and were more optimistic about the vaccine. So low trust environments
We've got one of the highest vaccine adoption rates
results
in the world,
death
in this country.
So these parties, it all seems like it's trivial, but it results in death if we decay the trust
We
in our
have
leadership
got one of the highest
in a
vaccine
pandemic.
adoption rates in the
really,
world.
Boris, once your girlfriend cheats on you, you're always going to be suspicious. Boris really probably does need to go. And I actually think, Rachel, interestingly, I don't actually think you trust Boris. I don't think he's the guy you would put in. I don't.
Rachel?
I don't. Do you?
Yes.
I mean, you supported Michael Gove for the leadership. Do you trust Boris Johnson?
Yes, I do trust him. I do trust him. I do trust him. And I think, obviously, there's been a lot...
There's a sort of murmur of what, disbelief from the audience?
Look, I'm probably the only person here who can speak on behalf of the government. So it's understandable that there's palpable anger in the room. And that's how it's going to be. And I perfectly accept that. This is a difficult time, and it has been a bad week. Let's be frank about that. Right. And the Prime Minister himself came to PMQs on Wednesday and apologised straight up and said he was sickened by what he saw, and that's why
he apologised for the video, not for the party.
Well, because it's an allegation. That's why he's appointed the Cabinet Secretary to carry out an investigation. Okay, and he's been clear that there will be disciplinary consequences. And we have already seen somebody lose their job.
Maybe this is a better question.
I'd like to answer your question. I mean, we've only met 25 minutes ago.
Can I just say one thing as well?
It's quite interesting that you can say what
I want to commend Rachel for doing something that our spineless colleagues wouldn't do, which was actually come here and answer the questions. Because it's like, it would have been much easier for you to do what all of your colleagues did yesterday and just avoid all the media. So congratulations there. My question was, of all the people you know, right, that you've met in your life and that you've worked with, if this room was on fire now, would you want Boris Johnson to lead us out of here?
Yes, I would.
Of all the people?
I absolutely would. Well, actually, I would probably pick someone from the Royal Air Force to lead me out of here. This room is on fire.
Okay, let's hear more from the audience. The man here in the front in the blue shirt.
I'd just like to go back to what Michael Portillo said earlier. You cannot say that we had a good COVID policy. I mean, hundreds of thousands of preventable deaths, right? Back in April, right, when Europe was already going into lockdown, he was going on to shows like This Morning and saying, oh, we'll let it rip through the population, it'll be absolutely fine. And then didn't go into a circuit breaker lockdown early enough when he was also promising us that we would have Christmas, told us that they were then going to be in lockdown over Christmas, so families split apart completely, and then was going off partying as well. You cannot say that we had a good COVID policy. It's ridiculous.
Well, actually, I do. I sustain my argument that since we got into the vaccines, which is from exactly a year ago, I think the policy has been well implemented until very recently, actually. So the rollout was extremely effective.
I mean, you were talking about before then, I think.
Yeah, I think that...
It did enable us then to get our freedoms back. But I had limited my remarks to that period. I agree that mistakes were made at the beginning. I wouldn't argue with you about that at all. But I think we had found a pretty good policy. And I think it has been a better policy than has been pursued by many other European countries, and vastly better than the policy pursued by Australia or New Zealand.
OK, I'm going to take another question from Ashek Hussain.
Has Plan B been introduced in enough time to prevent another lockdown?
Stephen.
I think Plan B, when you get such a illogical, inconsistent, bizarre political instruction from the government, it's probably not sincere. And what I mean by that is the fact that my colleagues at work are advised not to come to work, but they can still get loose at the Christmas party, means that these decisions weren't made based on logical science. They were just based on government signalling that they wanted to do something, because when they go into, the political debates, they're going to have to show, maybe in a month if it goes really bad, that they did something. But this is, there's no science behind that decision. We all know that. I can go to a nightclub...
Well, hang on a minute, because in fairness... Maybe I should let you say this, Rachel. But I mean, if you look at SAGE, for example, which is the scientific body advising the government, they have recommended that more restrictions be brought in. I don't think they've said go to Christmas parties, that I'm aware of, but they have said that more restrictions should be brought in. OK, so you can go to my Christmas party at work, but you're advised not to come to the office. Does that make any sense? It makes no sense. We all know that none of this makes any sense. It's all so super hypocritical and intertwined. But so you
with
think there should be no Plan B then?
No. But if we're going to do it, at least be sincere about it. What we're doing is just signalling to say they did something. They want to say they did something, but they won't do anything that will hurt the economy. Okay. So they're just doing enough to signal to the population, just in case it goes really bad, like it did last year. Well, we did something, because we know the Labour Party are just going to blast them if they do nothing. It's all signalling. There's no sincerity in any of it.
It is going to hurt the economy. It's going to hurt the economy hugely. But I think that the thing about this government, it's between a rock and a hard place, because it's libertarian by instinct, which I think is why people can have parties because they can do what they really want to do, and everybody else can just swerve it. But in order to deal with a pandemic, you need to be more authoritarian. So you hear yesterday in Parliament, you hear Tories talking about Plan B being socialism, and about how the government is bringing forward these socialist policies because it pushes against their libertarian instincts. It also frightens business because it doesn't know if it's coming or going at the moment. But we need to have a clear and focused direction, and it's hard because this government doesn't have a clear and focused direction, because it's being pulled in two different directions. There's mutiny on the backbenches in the 1922 committee. They're not feeling like, as Michael was saying earlier, they're not feeling that Boris is necessarily the electoral surefire thing that they thought he was going to be. The fireworks and the maverick that got him elected are not necessarily the steady, detailed, focused directive of a leader that you need in times like this. And I think, sorry, sir, at the front, you were talking about last year, and I think the government misunderstood the feeling in the general public. We are very willing to do the right thing, and I think that we could have locked down sooner. We could have had circuit breakers sooner, and people would have accepted it. But because they're being led by libertarians who don't want to do that, they don't want to do that. So we have these mixed messages now.
Okay, Michael.
I think the package of measures is preposterous for the reasons that Stephen said. They're wholly inconsistent. No one could possibly believe that they would be effective. The fact that they were introduced yesterday suggests that they were part of a diversionary tactic. The government had said that they wouldn't introduce any new measures until they could see that there was some effect from the new variant on hospitalisations. There has not been such an effect. Nationally speaking, hospitalisations are flat, deaths are flat, the number of infections is rising very slightly, but is comparable with what it was in August. So there was no reason, given what was happening in Britain, to bring in these restrictions. And if you were going to bring in restrictions, you would have brought in restrictions that were consistent. The original questioner said, is this going to postpone a lockdown? My own feeling is that we will probably not get to a lockdown. I go back to the point that I made before, that I think our COVID policy has been pretty effective. It means that a very large proportion of our population is either double vaccinated, triple vaccinated, or has already been infected. And the news coming out of South Africa at the moment, and let's hope that this is really a very good sign, is that people with the Omicron are less ill than people with Delta.
Though hospitalisations have risen by, I think it's 300% over the past week.
Hospitalisations have risen and the people are less ill. They're spending 3 days on average in hospital rather than 8 days. So this could be terrific news. Let's hope that it's going to be terrific news, because I think we are actually in a very, very strong position to restore our economy and our way of life to normality. And I was slightly surprised when Stephen said that these measures don't hurt the economy. Of course they do. If you stop people going to offices, of course that means that they're not going to spend in local businesses. Although the government says you can go to parties, lots and lots of people are cancelling parties. The travel industry is back on its knees. To say this is not hurting business, Stephen, I don't think is accurate. It is indeed hurting.
So that's not. So what I said is they tried to introduce measures they didn't think would. But I actually spoke to the nighttime economy advisor for Manchester today on the phone before this, and he told me, Sacha Lord, he said 25 to 30% of hospitality's revenue is made in December. And because of the last-minute knee-jerk reaction last night, the whole industry is seeing cancellations because people are now scared to honour their bookings. And it is kneecapping an industry that has been kneecapped for the last 2 years because of negligence.
The man in the check shirt.
Yeah. Just thinking about the way they've gone about this, is it a case that they are bringing in these changes because of what's happened in their own party and to divert attention, perhaps, with regards to, the previous question and the parties they were having?
I think that's what Michael's just suggesting. The wound at back in the sky.
Hi, thank you. Sorry, just to go back to some of the points that have been made about where we're at with the vaccination programme and what we know about the new variant. I don't think we know enough about the new variant, and actually locally in hospitals we are seeing significant pressure ahead of winter, ahead of general winter pressures when people are socialising, and we can probably have high rates of flu and other viruses. So I think that I don't really disagree one way or the other. I think it is going to have a real impact on the economy, but I think the plan B is to buy time to get more jabs into arms.
Okay. The man at the back in the sweatshirt.
Yeah, just on UK hospitalisations specifically, they were going down. They have now stabilised. So that is a change in the trend. Whether that then goes back up, I don't know. Just additionally, this is to do with a variant coming from South Africa, and the problem is that until you have a global population that is fully vaccinated at a similar time, you will keep having this problem. The issue also is not necessarily one of doses, but infrastructure and helping you. These countries can't really very easily always transport cold vaccines at low temperatures to remote rural areas. So until the West and developing countries start engaging in the infrastructure of that rollout, instead of just pre-ordering doses for us into infinity, we're going to keep having this problem.
Okay. Annalise, has Plan B been introduced in enough time to prevent another lockdown?
Well, we all hope that it will have been introduced in enough time to prevent another lockdown. But just on that really important point, if I may, very, very briefly, I mean, we actually saw last year in the UK, just in 1 month, in the month of August, 600,000 doses of vaccine being thrown away because they were out of date. Now, we could have got those to other countries. I accept the point about logistics, but we really need to accept that we're not doing all we can there to get the vaccine to other countries when it's actually surplus to our requirements. And you know, on that point that was made before about whether we in the UK are doing all that we can do, where I see the vaccine programme, I don't see Conservative government ministers doing the hard yards to deliver that. I see NHS staff and volunteers across our country who've done really, really well to get that programme running. We're not actually meeting the targets, though, for the booster, which
But what about the question is
moment.
about Plan B, Annalise. Has it been introduced in enough time? You heard Michael's point, who clearly doesn't support Plan B at all.
Well, we must hope that it will have been ultimately, because we cannot
And it's
have
something that
another
you support.
lockdown. Well, we've always said as Labour, we're not going to play party politics around the health measures here. Where the evidence is set out, and that's what the Health Secretary did in Parliament, where the evidence is set out and they say that it's justified, we won't argue against those measures for the sake of it. But we are really worried about what's happening with the booster programme being so far behind. We're concerned that we don't see any proper approach, it seems, for ventilation in our schools, a complete opposite of many other countries. When we've got kids and the only response for those children in their schools is, we'll just open the window. We'll try doing that in a lot of Britain in the middle of December and see if that helps you out. We still haven't fixed sick pay either. So there's a lot the government needs to do, and it needs to do it because of what the women said at the back. Our NHS currently, in so many parts of the country, is already massively struggling. You know, we've got record waiting lists, 5.5 million people on the waiting list. That's 1 in 10 people in our country on the waiting list. It's got so bad under the Conservatives. They should be focused on that.
Rachel.
So I think that this is a sensible plan. Obviously, any plan with restrictions in is going to be... I mean, no government wants to introduce that, full stop. So
and lots of your backbenchers don't want you to introduce it either.
We've heard a range of opinion here tonight. If you put more restrictions in, some people will not like that. If you put fewer in, other people won't like that. There is always an impact of restrictions. So any government has to consider very carefully where that balance lies. And that is a subject for debate, rightly so.
And just to the logic of encouraging people to work from home if they can, but to go to Christmas parties, what is the logic of that?
Well, because you have to consider the big picture. People's mental health was devastated in the lockdown. Going to a party and seeing your family and friends is a really important part of our life. And just back to the question...
But what about going to work and seeing your colleagues?
So this is about the big picture. It's about the balance. I mean, if you're going to work, you're going on public transport, you are coming in contact with a lot of people. Having some sense of normality is really important to people. And I think we need to look at what we went through last Christmas, and we do not want to go back to that. This programme of restrictions now gives us time to understand what the science is telling us. We know we've got a virus that is more transmissible, potentially very dangerous. We are seeing the impact on the hospitals. This is completely science and evidence-based. We need to buy ourselves time to understand this virus and its impact on our population. And at all times, we must act to protect public safety. That is the overriding priority of this government.
Let me just take a couple of points before I move on. Yes, the man here in the front.
Is there any more the government could have done over the past 6 months to prepare for this?
All right, and the woman in the stripy dress then.
I think it's really perplexing for employers, because I work for an organisation that needs to stay open because we're doing medical research and surgical training, and it's really important we keep everyone safe who's coming into the workplace. So I'm telling staff to stay at home if they don't need to come to work on a specific day, although a lot of the time they do. And we don't know whether to cancel the Christmas party because we don't want to put people at risk, yet we're told we can have the Christmas party. I think that's really, really confusing. And it's also confusing because if you're in contact with somebody and you're fully vaccinated, you don't need to isolate, except if it's Omicron, then you do need to isolate, but you don't know if it's Omicron until you get a PCR test, and that could be a few days later. So the whole thing is just terribly, terribly confusing, I think, at the moment.
So help this lady out with her employees. Was it medical research you do?
Organisation that
does medical research. So what's more important, encouraging people, getting people to come in, to work or getting them to come in for the Christmas party?
So I think employers will have those discussions with their employees, and there are a vast number of different ways that people can work now. We've all got used to that in the pandemic. Employers have made that adjustment all the way through.
So what do you think her company should do?
In terms of what exactly?
In terms of exactly that. Should she be encouraging people to come into work? Or should she be encouraging people to come to the Christmas party?
So the government guidance is work from home unless you can't work from home. And that was where we were at the beginning of the pandemic.
And for the Christmas party?
So we have said that Christmas parties are okay to go ahead. That's the current guidance. Can I just say we keep all measures under review all the time, and it's based on the evidence.
Does that help?
Not really, because I think putting everyone together in the Christmas party, 30 people together in a room, and people go down with COVID, that's a serious risk to the organisation and to research. We probably will do something. We'll separate onto tables. We're allowed to do it by law. But to me, it's a nonsense that I want everybody to enjoy themselves, obviously. But to me, it's a nonsense that we're allowed to come to work if we need to, but we're encouraged to stay at home. But we're allowed Christmas parties. It's just it's a contradiction.
Okay. All right, we hear you. We hear your dilemma. I hope you enjoy whatever it is you end up doing, or not doing, as the case may be. I'm going to go to another question, but before I do, I just want to tell you that next week we will be in Stoke-on-Trent. So do come and join the audience if you live in Stoke-on-Trent or around the area. It will be our last programme before Christmas. Not a party exactly, but dare I say it? Oh my goodness. But there'll be plenty to talk about, I do not doubt. We would love to see you. So if you live in Stoke-on-Trent or around the area, do go to the Question Time website and apply, and we would love to see you there. Right, let's take another question now from Tony Fine.
What can be done about people who refuse to have the vaccine? They have the right to choose, but in doing so, they're draining the NHS staff, the beds, the resources.
Just out of interest, what would you do, Tony?
Oh, I've been...
No, but what would you suggest?
I stop short of saying they should not be allowed the resources because we have free choice. However, I always paid my taxes, and I knew getting older would have medical challenges. But I always thought if I slipped on the ice or had a stroke or had a medical emergency, the NHS would be there for me. And I feel that people who refuse to have the vaccines are jeopardising that safety.
Okay. Adria?
I think that it's very difficult, isn't it? It feels like it's a conversation that's almost as divisive as Brexit in some families as well, because I think there's vaccine hesitancy, where people are just concerned that they think the vaccine's being developed too quickly and they don't know what the side effects are going to be. I know that my eldest daughter's just had a baby and she was very concerned about when she was pregnant, should she get vaccinated or not get vaccinated. So I think there's vaccine hesitancy at one level. There's also vaccine complacency. You know, so I'll get it done. Or, you know, you're young and you're going to live forever and you're Teflon, so you'll be fine. And then I think there are absolutely people who are anti-vaccine because they have big pharma conspiracy theories and all sorts of other things, or who just think...
So what should be done?
It's just flu. Well, I think that... so we know that Boris has sort of run the thing up the flagpole about we need to have a conversation about whether it should become mandatory. You know, the dog whistle politics that throws it up there. And Sajid Javid today said that he thought it would be immoral and impractical. And I sort of understand why he would say that, because I think we need to have buy-in is the way that you get people to join in the willingness to be vaccinated. So I think we need...
so not mandating people to do it, not forcing people to do it, but persuade them.
How do you force people to do it? Do you strong-arm them into clinics and then pin them up against the wall? And I mean, how do you force them? It's difficult, isn't it? And you know, I think we need to talk better. We need to have clearer, more honest conversations with people. People need to understand that this has been a vaccine that has been been in development in various ways for quite a long time, but we also need to acknowledge why some people are worried about it. You know, people are worried about it the way they might have been worried about MMR. I know lots of people from ethnic minority communities are worried about it because we know about the history of medical experimentation and exploitation of certain communities, and it makes people anxious and suspicious, particularly when you say it might be mandated.
All right, let's hear a bit from Ulrich. The woman here in the front.
I'm a non-clinically trained vaccinator. I chose to train up at the beginning of last year. And what is incredible to me, especially with the booster programme, is recently, over the last few weeks, I've been doing a lot of first doses for people who have otherwise not wanted. And when I've asked what's made them come into the vaccination centre to have their vaccines, it is because they want to go and visit their families abroad and they're not able to get on an aeroplane. It's very difficult for them to do certain things now. And although I don't condone anything mandatory and people do have personal choice, I do feel that if we do put into place some rules that make life very difficult for people to be able to function and do certain things, we will see a huge shift in that younger generation who have got huge vaccine hesitancy for one reason or another coming forward. And they are 9 times out of 10 young, in their 20s and 30s, who have just been very, very blasé, it's not going to happen to me, who are now realising, actually, I want to go and visit my friends, I want to go and do these things. And that message is becoming clearer and clearer with the more rules that are coming out there. So I think it's a good thing.
The man in the check shirt.
Going back a few months, in France, in Spain, to a certain extent in Italy, they introduced vaccine passports so that those people who did not have passports could not do hospitality, they could not do entertainment, so there's effectively becoming a two-tier society. If we were to introduce something on a similar sort of level, I'm sure we'd suddenly find a number of people would take up vaccinations if they suddenly see they're not able to participate in going to restaurants, in being able to go to football matches, to being able to go into entertainment. That would increase the numbers without having to force people to take the vaccination.
And that is, in fact, part of Plan B, having COVID passes for big venues,
and it's
big entertainment
not
venues.
the whole
It is
thing,
already
yeah.
happening.
Yes, the man there with the red tie.
I think the point is people should be at liberty not to take the vaccine. That I think in this country, the libertarian country, as one of the panelists have said, and that is their right. But do they then have the right to infect others? Because that is the implication of what they do. And therefore, I agree with the person that spoke before me, their right to go out and to infect others have to be curtailed. That might include going on public transport. It might even include going to their place of work. If we as a nation are saying that the vaccine for the vast, vast majority is safe, and those that refuse to take it or are blasé in taking it are risking the health of those others and vulnerable people in our society, then their liberty to do what they want to do has to be curtailed if they risk the health of other people.
So, Michael, what's your view on that in terms of what the people in there are saying? I mean, not being able to go on public transport, say, for example.
I was just thinking, I was double jabbed and I tested positive for COVID. So being double jabbed, unfortunately, doesn't stop you having the disease and doesn't stop you transmitting it. And I think that makes it quite hard to convince people that you're entitled to take away their liberties when you can't convince them that they will then not be transmitting the disease. I think there's been a collapse in the first and second vaccination programme. We're down to about 26,000 a day of first vaccinations, and we've still got a lot of people who haven't had the first vaccination. So what I would want to do is would want to analyse what the problem is. In my borough, Westminster, I think we're not at 60% double vaccination. In other boroughs in London, we're at much lower levels than that. We've referred to the problem with ethnic minorities. I think amongst black communities, 60% is about as high as you get. So I'm not sure that these people are going to respond to being clobbered or being told that they have to become second-class citizens. What I really am surprised at is that we haven't seen the evolution of a strategy that does target ethnic minorities, find out what these worries are, use role models who are going to appeal to those communities. We just don't seem to have had the granularity in our approach. We don't seem to have discovered what it is about these populations that makes them so hesitant to be vaccinated and to address those concerns and those anxieties. I do not think that clobbering them is going to be the answer.
Stephen.
I agree, interestingly. I find myself in the middle where I'm double vaxxed and I know I believe in vaccine. I mean, I think to even say you believe in vaccinations is nonsensical because it's science. But to answer your question, Michael, about why some communities and some people don't want to go and get the vaccination, the data is actually really clear. Education is a big factor. You tend to find that in areas where there's a lower understanding of science and a belief in science, vaccinations are significantly lower. And the other really important thing is trust in governments and institutions, because at the end of the day, it's Boris Johnson, Mr. Reality Show, that's telling me to go and get this thing. So do I trust this man? Do I trust the government? So when they become a reality show and comical, that again, you see across Europe, low trust equals lower vaccination rates. There's positive correlation to back that up. So education, trust, and then separate issue is the disinformation that's being spewed out of algorithms across social media. This is my industry. I've been at the heart of social media for 10 years. I can't even log on to Facebook anymore without some nonsense about 5G or vaccines. When we can clear that up, which is a much more effective form of education to a certain generation, you know, the science and stuff is secondary now to our timelines and social media news feeds. Maybe we can make some progress in convincing people of the truth, which is that vaccinations are important, and we won't need to do these really unpleasant mandates.
Okay. The man at the back in the middle, the blue shirt.
Hi. I've probably produced my vaccine passport about 10 times since I've been able to download it, and I'm not remotely convinced by its effectiveness. If I'm going into a football stadium where they have to get 50,000 people in, you cannot expect the stewards in the stadium to scan every single passport and check the name. It's not going to work. You can say the same for nightclubs as well. You're talking bouncers who want to get the people into the club so the club doesn't lose money. They don't work. People they can bring out print screens if they want of someone else's vaccine passport. They'll just do that if they need to. They don't work.
Okay. And what do you think should be done then?
I don't know, really.
Okay,
I just don't
fair
think it
enough.
works.
It's a difficult question.
Yeah.
The man in the blue top, yes, with the glasses.
Yeah, just following up on Stephen's point, where you have a situation where Omicron, and the situation here is about trust, where you have a situation where you've got a variant that has been discovered in South Africa, then you've got your travel red list, and then you've got Nigeria, which is so far away from South Africa, on the red list. How do you explain to people the rationale behind Nigeria being on the red list?
Okay, and the woman, yes, there with your hand up, yes. Yes, at the back, yes, you.
Hi, I think the nail has already been hit on the head in terms of science education. I think not a lot of people have the education to understand what the vaccine is right now and how it's been developed and how there has already been a SARS vaccine in development way before COVID, so that people can understand that it hasn't just been taken out of a cupboard and gone, oh, we've got a vaccine, we found this magical thing. I've watched every news briefing that said, get your vaccine, do this, do that. I'm pro-vaccine, I have a background in science, but no briefing I've ever seen has given a breakdown so that someone that doesn't have my understanding or background can understand what it is and why it is, and how, in terms of a virus, your own individual health is actually public health and how it impacts each other. So I think that it should be more a point on education at this point in time, because as much as I protect my own personal views, say, unless you have a medical reason why you shouldn't have a vaccine, I think everyone should have vaccines. You can't force it upon people, and you need people to understand the overall benefit to society, and living in a society does have rules.
So, Rachel, what can be done about people who refuse the vaccine? We heard Boris Johnson, as I just said, opening up the idea of the possibility of making them mandatory.
I think it's been a really interesting debate and people have expressed various opinions. I think it does come down to education and science, as I think the lady has just said. I think it is really important that everybody understands that these vaccines are safe, that they are available, they are going to save lives. And I think actually across the whole of the pandemic, what we have seen in this country is people have got that message, and they do have trust in science. As you yourself have said, Stephen, they do trust the scientists that they do see on the TV every night.
And what about Michael's point about a lack of granularity in terms of the government taking people with them, even those who are reluctant to have the vaccine?
Well, I think it's an ongoing piece of work, and we have to keep going on that. But actually, I think we have, and this is one of the successes of the programme. We do have one of the highest uptakes of vaccine uptake in the world, actually, in terms of our population. That is evidence that people are listening to that and they are taking their vaccine. I mean, Michael is right in one way that we have to have targeted approach. We do have to use people that are trusted figures, not just the government, because of the reasons that everybody said tonight. There has to be people in the communities, and that's what's happening, actually. It's certainly happening in my community. When I speak to my Director of Public Health, they are working very closely on the ground with local communities, with local directors of public health who know those communities, and they can go out into with trusted people. For example, in my local mosque, that's what's happening. I've seen it on the ground. It's incredibly successful. We need to keep doing that.
Annalise, I'm going to try and get another question in, so I'll ask you to be reasonably brief, if you will.
Right, I'll try and be really, really quick, because I think we actually already know what works from what's taken place in Wales. But the Labour government there, from the very beginning, said, right, we're going to be very clear with our communications. Those communications were trusted by people a lot of the time, but they also made sure that it was really, really easy for people to get vaccinated, because they made sure the vaccination took place where people were. And that was really effective. So we don't have to remake the wheel here. Let's just look at what has worked in our own country. And if we look at Wales, I think we can see how we can get those rates up and very quickly, including, for example, amongst social care staff and others. We can do that really, really quickly. And that should be the debate, to be honest, rather than, I think, the Conservative government floating these other ideas.
Let's take a question now, a last question from Zoe Qatar.
In the light of the imprisoning of Arthur Lanijo Hughes' dad and stepmother this week, what safeguards are the government putting in place to ensure that no more children suffer such horrible deaths in this country?
So this is the almost unbearable case of 6-year-old Arthur Lavinia Hughes. He was killed in Solihull by his stepmother. His father has also been imprisoned as well, and he was beaten, starved and tortured and died. And there were a number of occasions where his extended family, the school, approached social services and the police, but yet somehow he still ended up dying at the hands of those who obviously should have been looking after him. Michael.
Well, there will be an inquiry, but, I mean, so far, what we know is that the grandfather gave warnings, the grandmother gave warnings, the police were told, social services were told, social services saw the child. There was a history of violence in the family, which almost certainly should have had the child put on a watch register. So when you say what more can the government do, I really don't know, because we shall see what the inquiry says. But from what we know so far, it just looks as though one person after another didn't do exactly what was needed. I don't know how to legislate for that.
So how do you legislate for that for Rachel? There have been so many inquiries. I remember covering the case of Victoria Clamby. I remember going to meet her mother in Ivory Coast. What has to change? What can government actually do?
I mean, it is an absolutely shocking and horrific case, and no one can read that without being affected. It is the right thing to do that we have that inquiry.
But there have been so many inquiries, and this still keeps happening.
Absolutely, and I accept that frustration. And as Michael has said, that there is going to be an inquiry. We need to look across the whole system to see who were the individuals that came into contact with that family, what was not done that should be done. Clearly, when cases like this come to light, it shocks the whole country. That's why we have to have the inquiry, and we have to make sure that we do listen to the outcome of it.
Woman here in the purple sweater.
It's absolutely important to do that. This is not the first time this has happened. But there is a question about the state of the system, and the system appears to be on its knees. You see, like, local authorities who just don't have enough social workers. You don't have enough people in the and people are. You've got social workers going sick. You've got the caseloads are absolutely huge and massive. So actually, should we be putting more money into this to support the people to do their jobs properly, to prevent this sort of thing happening?
Adria.
obviously there should be an inquiry, but I don't want to hear about any more children being treated in these grossly disgusting ways and things falling off a cliff because we have a social services system on its knees, face flat on the floor. We are not investing in taking care of vulnerable people in this country. When I was a kid, social workers, it was a swagger job to be a social worker. You had a 2CV and you went to France on holiday camping in Brittany if you're a social worker. It was a glamorous job, it was a professional job, it was an honoured profession, and it was attractive. And I think that we are not investing enough in our social workers, in our local authorities. We have children in unregistered, children as young as 11 in children's homes that are not regularly monitored or taken care of. We are not looking after vulnerable people in this country, and then we throw up our hands and say, oh, we must have an inquiry. You know, we are not systematically taking care. We have got...
Actually, I've got to bring in Ms. Pansy. I'll have to ask you to be brief if that's...
OK, very quickly. Capital gains tax. Last week we were going to have capital gains tax. Potentially it could bring in £14 billion. This week we're having a tax cut just before an election, which may lose us £12 billion.
I mean, these are proposals we're talking about.
Should be going into social services and into the health service and into looking after these people. Steve.
Just to echo the points, I think it's spot on. I think it's so easy in these situations to sometimes blame the people in the system, but it's the system itself that I think should get the blame. And when I look at this from a business perspective, if a department in my business isn't functioning and it needs higher standards, that means it needs more attention and more resources. And as we neglect social services and the education system, this is the unfortunate consequence, where standards are low because they're overstretched, they're overworked, and until the government takes social services and childcare in this country seriously, unfortunately, we're going to be having this debate again soon. So I think this is the unfortunate wake-up call that this country shouldn't have ever had to need. And I really hope Boris and the Conservatives hear it in a very lasting way. And rest in peace to Arthur, because it was that story just broke my heart, and it's been unthinkable.
Annalise.
Well, exactly. I think it was just such an absolutely atrocious, horrendous case, and anybody looking at it would just be totally shocked at how this could happen. I mean, Michael set out the fact that warnings were raised so many times, and we do need to wait to see that inquiry. But I would say we have also, independently, beforehand, there was such a strong case for action on children's social services. I mean, we even heard from the former Permanent Secretary saying that children's social services, he said that it was terrible, the state that they were in. Okay, he made that assessment, months ago. So we've got to see action around this. I agree, it's a reflection of our priorities, frankly, as a society. It's a reflection of the government's priorities as well. If we're not protecting the very most vulnerable in our society, then I think we're doing something very badly wrong.
Okay. Our hour is up, I'm afraid. It's a very important subject, and I wish we could spend more time talking about it. But our hour is up. Thank you very much to the panel for coming along this evening. Thank you very much to our audience here at the RAF Museum in Hendon, unusual location for Question Time. Thank you very much. And, of course, thank you to you at home for watching. From Question Time, bye-bye.